To everyone, my name is Luis Montalvo and I'm a med student at Universidad Católica Santiago de Guayaquil. Today I'm going to talk to you about fracture prevention with Zoledronate in older women with osteopenia. But first, here are my Facebook, Twitter and YouTube accounts so you can visit them and watch my other video in which I talk about the effects of leukotrienes in asthma. Introduction. We must know what the definitions of osteopenia and zoledronate are. Osteopenia is a term to define bone density that is below normal but not as low as osteoporosis. And zoledronate, also called zoledronic acid and marketed by Novartis under the trade name Zomed and Reclast, is a biphosphonate. Applications in medicine. Osteopenia and osteoporosis both are varying degrees of bone loss, measured by bone mineral density, a marker for how strong a bone is and the risk that it might break. The main way to determine your bone density is to have a painless, non-invasive test called dual energy X-ray absorptiometry that measures the mineral content of bone.
Charlene Greenfield is in great shape. Good thing, because she's fighting a battle against osteoporosis.
When I got my first bone density test, I was shocked because I'm very healthy.
Osteoporosis is most common in women over the age of 50. It's a condition where the body loses calcium and vitamin D, which drastically affects bone health.
What happens is as the calcium leaches out of the bones become fragile, brittle, and are at greater risk to break.
In early stages, doctors recommend calcium supplements, but as the condition worsens, treatment moves to drug therapies, ranging from once-a-day pills to once-a-year IV transfusions.
And they all work very well in helping to reduce the number of fractures in women going forward, but they also have side effects.
Chief among them, upset stomach. It caused Charlene.
Now, bone mineral density. The measurements known as T-scores determine which category, osteopenia, osteoporosis, or normal, a person falls into. There are 4 levels. Normal is a bone density which is between 1 and -1. Osteopenia, which is between -1 and -2.5. Osteoporosis, which is -2.5 or below, and finally severe osteoporosis, which is a person that has a bone density of -2.5 and there have been 1 or more osteoporotic fractures that this person has suffered. So 4 levels: normal, low bone mass or osteopenia, osteoporosis, and severe osteoporosis.
Hi, my name is Retna, and I'm a radiologist technologist here at MD Anderson Diagnostic Imaging Center. Here today we will be talking about bone mineral density, otherwise known as a DEXA scan. A bone mineral density test, or DEXA scan, is one of the most accurate ways of assessing your bone health. A DEXA scan measures your bone loss over time and can detect osteoporosis, which is a disease of the bones. It causes bones to be weak and break easily. The doctor uses the results of the test to evaluate your risk for fractures. At MD Anderson, we use dual energy X-ray absorptiometry, or DEXA scan. It uses X-rays to measure bone density in the hip and spine, and occasionally in the forearm. You are exposed to a very low dose of radiation. Bone mineral density tests are easy and painless. No special preparation will be required. You can eat or drink whatever you like before the test. You will change into a gown, remove any clothing that contains metal buttons, metal buckles, or zippers. Please tell your healthcare provider if you are pregnant or think you are pregnant. A DEXA scan could expose the developing fetus to radiation, which should be avoided. Have recently had any radiologic tests that used an oral contrast dye such as an abdominal CT or barium swallow. The contrast dye may interfere with the bone mineral density test. You will have to wait 1 week after the radiologic test before you can have a DEXA scan. During the
Zoledronate, biphosphonates are the principal class of medications used in the management of postmenopausal osteoporosis and osteopenia, and have been shown to prevent fractures. In 2007, Zoledronate was approved for treatment of postmenopausal osteoporosis in both the USA and Europe as a 5 mg once-yearly infusion. Other uses include the treatment of Paget's disease and prevention of some forms of cancer from spreading in the bones. Pros and cons. Zoledronate reduces the risk of fragility fractures in patients with osteopenia. Treatment of Paget's syndrome. There is a reduced risk of mortality and vascular disease and anti-tumor effects. Now, what I'm talking about is that I read an article which talked about the use of Zoledronate in patients with osteopenia, in women, postmenopausal women with osteopenia, and there were 100,000 patients that received a placebo and 1,000 patients that received the placebo and 1,000 patients that received the drug Zoledronate, and there was a lower risk of mortality and vascular disease in the patients that received the Zoledronate. There were less strokes, less myocardial infarctions, and less vascular events. And in another study in which Zoledronate was used, there was proof that it had anti-tumor effects. So women had a better condition after they used Zoledronate, especially women that had breast cancer, because the study was about breast cancer. Cons. The cons are the adverse effects that this drug has, and the most common effect is an acute phase reaction. The acute phase reaction is a systemic reaction of the organism to an strange substance, and it causes symptoms like fever, chills, lethargy, decreased appetite, and hypotension. And another adverse effect that patients in the study I read had was iritis, which is an inflammation of the iris.
Hi, I'm Dr. Andy Thompson, and I'm a rheumatologist. Today, I'm going to talk about Zoledronate for the treatment of osteoporosis. You can visit our website, www.rheuminfo.com, and print off one of our Zoledronate picto pamphlets to follow along with this video. Zoledronate is also known as a class step. Zoledronate is given once a year by a 15-minute intravenous infusion. Now, there are 4 things you need to do when taking Zoledronate. First, to help build your bones, you need to take calcium and vitamin D. Your doctor will tell you the right amount of calcium and vitamin D for you. Second, Zoledronate should not be taken during pregnancy or breastfeeding. Let your doctor know if you become pregnant or are planning pregnancy. Third, medicines like Zoledronate have been associated with a very rare problem with the jaw bone. Now, this problem has been seen after dental work. Let your doctor know if you develop sudden pain in the jaw. And finally, your doctor will monitor your response to Zoledronate by testing your bone mineral density. This is usually done every 1 to 3 years. After receiving Zoledronate, some patients have developed a fever and flu-like symptoms where they feel out of sorts or experience chills, fatigue, and weakness. Now, these symptoms are usually mild to moderate and go away after a few days. Zoledronate can cause stomach upset with nausea, vomiting, or diarrhea. Zoledronate can also cause headaches or bone, muscle, or joint pain. Finally, Zoledronate has been associated with abnormal heart rhythms like atrial fibrillation. Tell your doctor if you've had a heart rhythm problem. If you're taking Zoledronate, you should call your doctor if you feel sick after the infusion or if you're concerned about any side effects. For Zoledronate, there are other specific reasons to call your doctor. If you develop stomach pain or trouble swallowing, if you are pregnant or planning pregnancy, if you develop new severe pain in the jaw, and finally, if you're having any upcoming surgery. I hope you found this video to be useful. For more information, please visit our website at www.roominfo.com.
Issue applied in Ecuador. Globally, the prevalence of postmenopausal women with osteopenia is 40 to 50%. And in Ecuador, there is no data of prevalence of osteopenia. I found two articles, one in which someone talked about osteopenia in patients from Chimborazo, and another one which talks about osteoporosis and osteopenia in patients from the Amazonic region, but there are no data of the prevalence in Ecuador because these articles just talked about a low number of persons that had these conditions.
El Patronato Municipal de Ibarra inició una campaña médica de desintometría ósea para verificar los niveles de osteoporosis y osteopenia en los pacientes.
Es un problema que generalmente un gran número de mujeres, principalmente por nuestra constitución hormonal, tenemos en mayor frecuencia, especialmente cuando ya entramos a la etapa de la menopausia.
Sin embargo, también se presenta en pacientes varones.
No es que sea una patología que incida o que tenga una gran, digamos, incidencia y prevalencia a nivel del cantón, pero sí es importante hacerse y dar a conocer. ¿Por qué razón? Porque es muy importante prevenir.
En ese sentido, la campaña también incluye la capacitación en las medidas que deben adoptar para evitar tener estas enfermedades.
Pues nosotros cuando viene un paciente, por ejemplo, con osteopenia, con osteoporosis, además del tratamiento indicado, le damos cuáles son las medidas nutricionales que debe tener. Por ejemplo, evitar bebidas gaseosas, el evitar un poco el café, el comer más alimentos que tengan calcio como el chocho, la soya, etcétera.
La respuesta ciudadana fue positiva en la primera semana de campaña.
Más o menos hemos tenido una afluencia de 60 pacientes al día. Hay que tomar en cuenta que la densitometría es un poquito más extensa porque siempre se demora un poquito más y lastimosamente por esa razón no hemos podido atender a más pacientes porque más o menos estamos en un promedio de aproximadamente en unos 8 a 10 minutos por paciente.
Esta se reanudará a partir del próximo martes.
Vamos a reanudar el próximo martes, miércoles y jueves, es decir, el 5, el 6 y 7 de junio.
La principal causa de la osteoporosis y la osteopenia es una deficiente alimentación en la niñez y adolescencia,
que es donde nuestros huesos se calcifican. Entonces, si nosotros tenemos una buena alimentación durante estas dos etapas, definitivamente vamos a tener un calcio que nos pueda servir en la etapa de la menopausia.
Nancy Valdivieso, Prisma Informativo.
And conclusion. The conclusion is that Zoledronate reduces the risk of fragility fractures in older women with osteopenia.